Hi, everyone. It's Dr. LaTowsky. Thank you so much for joining us, TGIF. Today, we're talking about falling back into Fraxel. Many of you have heard me talk about Fraxel before, but we are falling back into it today because it's such an amazing treatment. It's the gold standard for many different types of conditions. So for those of you who haven't heard me talk about this amazing laser, it is a laser that is minimally invasive. It is considered skin resurfacing, but it treats a fraction of the skin. It treats in a pixelated fashion. So we're not treating 100% of the skin. We're treating a certain percentage of the skin. And that percentage is something that your doctor or nurse treating you, we choose the percentage based on our goals and your individual factors. So when the light goes into the skin, it's absorbed into the skin as heat. And what's unique about Fraxel is that the light can go very, very deep. So this laser can penetrate very deep into the skin. And the fact that it is fractionated or pixelated makes it extremely safe. So we can do things that with Fraxel that we couldn't do before Fraxel was invented. So how does that translate into everyday life? We are treating uneven skin tone or pigmentation with the Fraxel. We are treating acne scars. In fact, I think that Fraxel is the gold standard for acne scars with the Fraxel. We're treating surgical scars. We do this every day for surgeries of all sorts. And scars, even traumatic scars, and surgical scars, age spots or sunspots. We treat fine lines and wrinkles. We treat melasma with the Fraxel. Fraxel is extremely effective on melasma. And we treat, believe it or not, precancerous spots with this laser. So let's talk more about that. This is unbelievable, but Fraxel, it seems, really can reduce the number of precancers anywhere from 56% to 83 to 85, 87%, depending on the study that you read. And the hypothesis is the more that you do the laser, the less precancers that you have. And so what that does is it translates into less skin cancers. And recently, last year in 2003, this was actually proven. So a lot of these things make sense intuitively, but medicine is about the objective data. And so now we have objective data. This study was, as I mentioned, published in 2003 in the study of dermatologic surgery, and it came out of Harvard. And these Harvard doctors did a study where they looked at patients who had Fraxel between 2005 and 2021. This is called a retrospective study. So they went back and looked at all those patients, and they found that the patients who had had the Fraxel treatment developed less skin cancers. And then they analyzed that data, and they found that it was statistically significant. And they did see some evidence that the more treatments you've had, the less likely you'll get a skin cancer. So in other words, more treatments equals more protection, but that was not the primary endpoint. So more research needs to be done into that. Here is another study. This one was not as large as a previous study, but also published in 2023, last year. And it's out of George Washington University. And again, fractional laser, which is Fraxel, for prevention of non-melanoma skin cancer. And again, it talked a lot about by preventing the precancers, we are preventing skin cancers. And then finally, the study published in 2021, actually they looked a little bit more into the nitty-gritty science of why this is happening. And this study was really interesting, I thought, because it actually shows that some of the cells in our skin that get very tired over the years, tired with age and sun exposure, and then they don't work as well. And then they can eventually lead to abnormal texture and then precancers and skin cancers. And so those cells actually were shed and replaced with new cells. And I think also, yeah, they were eliminated. And so this is something that this study really, really emphasized the preventative nature of the Fraxel. So here's just 3 recent examples of what benefit this laser can do. Now let's see real life examples. So this is a patient of mine. He had these precancers on his face. You can see them with the arrows and the circles. Look after one treatment, you can see his skin is smoothed out and those precancers are gone for now. In addition, you see a lot of other improvements. You can see his texture looks healthier, and you can see that the pigmentation is improved. This is all from the aggressive exfoliation and the removal of those cells that are acting old and abnormal, and they're being replaced with new and normal cells, which again, we're now learning is great for the look of the skin, but it's also great for the texture of this or the health of the skin, preventing precancers and skin cancers. Here's a gentleman. He came in solely for the global treatment of these precancers. So he got really great clearance of those precancers that you see circled. Also, the lighting isn't great here, but you can see that his skin just looks healthier. It just looks glowier. It even looks less red after one treatment for these precancers. And of course, we treat the full face when we're doing these treatments. So we're doing a global treatment, which is really nice because we're treating not only what we're seeing, but what may be coming up in the near future. So I have a lot of patients who will come in and do this treatment once a year, like I said, solely for the purpose of making their skin healthier. They don't want to develop skin cancers. They may have had skin cancers in the past and they want to not go through Mohs surgery again. And so they come in, they're doing this once a year. We're seeing not only an improvement in the health of the skin, we're seeing a decrease in the number of precancers. And then we are also, of course, seeing those wonderful cosmetic benefits of the Fraxel laser. Because of the amazing amount of collagen formation, we are also seeing amazing results in Fraxel for acne scarring. And like I said, this is well known and has become the gold standard of acne scarring, although we have other options as well. A lot of times here in our office, we can actually combine several different treatments. My favorite thing for acne scars is what's called multimodality treatment, using multiple different devices and techniques for treating scars. And when you're using these different mechanisms of action, you get a better result. So for instance, a lot of times someone will come in and we may do a little subcision, which is manually releasing the tethers that are pulling down the skin. And then I might put a little bit of Sculptra, which is something that boosts our collagen from underneath. And then I may do a series of Fraxel treatments to boost the collagen from the top down. So we have lots of options for scars, but I really, really, really love Fraxel for scars. So here's an example of acne scarring. And this also this patient also brings up a point that Fraxel is safe in all skin types. We do adjust the settings for different skin types and different levels of sun exposure, but I can do this laser in any type of skin. And then here's another beautiful patient, and you can see how much smoother her skin is after one treatment. So There are so many things out there. It can be very overwhelming as a consumer as to what treatment you want to choose. So, again, I want to stress that Fraxel can really penetrate the skin deeply, and that translates into more complete repair and more vigorous collagen production. Also, when you compare Fraxel, which is fractionated erbium and tellurium wavelengths, you get less downtime than a fractionated CO2 laser, a quicker recovery, and I think results are the same or even superior to fractional CO2. So I am a huge fan of this laser. If you do this laser, what do you want to do beforehand? Well, you want to limit your sun beforehand, and the darker your skin, the more important that is. So a lot of our patients do the Fraxel between October and April, and we call that Fraxel season here in Arizona, although we do the Fraxel year round, but this is really the ideal time to do it because our sun here in Arizona is not as potent, and it's easier to avoid the sun when the days are a little shorter. Just so the skin is hydrated, you want to stop the use of retinol or harsh exfoliating products about a week ahead of time. Some patients have been on retinol or tretinoin for years and years. They have no response to it. I don't really mind if they continue to use it as long as the skin is nice and hydrated and not irritated when they come in. I really feel like that's the perfect place to start for this skin improvement. I would avoid self-tanners about a week before treatment. A lot of times we're cleaning the skin and we're wiping off all the tanner that you have on your skin. So it's just kind of redundant to do self-tanners right before you come in because we're going to clean it off with our vigorous cleaning methods here. And then this is a pretty strong treatment, so we don't want you doing a ton of other stuff at the same time. We want to really maximize our body's ability to produce collagen. So in order to be a better value for you, my advice would be to just let the Fraxel do its magic. You can hold off on other things or do other treatments for other parts of your body in the time around the Fraxel treatment. So during treatment, you will spend a few hours with us, and we have this really amazing numbing schedule, and our teams here are really trained on numbing for the maximum amount of comfort. So it's very common for us to have patients come in and say, oh, I don't want to do Fraxel because it's very sensitive and I don't like it. I don't want to sit through that. But with our numbing technique, patients end up saying, wow, that was nothing like what I've had in the past. That was actually very easy. I would do that again, absolutely. So our numbing technique really does take the edge off, and it's all topical. There's no pills, no injections, etc. The treatment itself, we can do pretty quickly. I've been doing this treatment for 20 years now, so it doesn't take me very long to treat somebody. So usually 15 minutes for the face, and if we do face, chest, and neck, we're going to do like 30 minutes of actual treatment time. The Fraxel has this unique device that's called a Zimmer, and it blows cool air on the skin as you're being treated. That helps to keep the skin as safe as possible by preventing overheating, but it also helps with comfort during treatment. And so that's another thing that will really keep you comfortable is this cool air that is simultaneously being delivered as we're doing the treatment. And then you can have a sunburn feeling afterwards. So for most people, it's like an hour afterwards. It's a very familiar feeling. Some people don't feel it at all, and other people can have it last, it says 1 to 3 hours. It can last up to 24 hours, but that's pretty rare to have that happen, but it can happen, and that's normal. Afterwards, I do have skincare that I've picked out that I really believe enhances the healing time and it enhances, or it speeds up the recovery. So it enhances the collagen that you're making as part of the wound healing, and it speeds your recovery time. I generally say for the face, expect about 7 days of downtime. The neck takes a little longer to heal. The chest takes a little longer than that to heal, but those areas are easy to cover, not very noticeable. So most patients just need to know that they want a week of downtime for their face. I would limit your sun afterwards. Wear sunscreen, which we give you as part of your skincare package. And usually for the first 3 days, your skin will be red, and then it kind of progresses to this bronze discoloration. And it's got this sandpaper texture, which eventually is going to be the part that peels off and is going to reveal baby fresh skin after that happens. We don't want you to pick at the flaking skin. And we give you a very detailed packet that I have written, and it doesn't leave much open to interpretation. So it's very, very detailed, and patients usually are very happy to have all the details there during recovery. Okay, so what does that recovery look like? Well, here's an example of Annika, one of my amazing medical assistants, and she's very fair, as you can see. So she's going to look quite red compared to someone who's darker complected, but this is kind of nice because it kind of shows you in terms of redness, worst case scenario. So right afterwards, you see that redness. Day 1, she's looking quite red. She's puffy. She's starting to get a little bronzish. Day 2, it's turning less red and more bronze. Day 3, it's mostly bronze. Day 4, now she's starting to peel in places. And then you can see as the time goes on, she's peeling more. And look at that baby fresh skin after she's peeled. So this is a day by day, and it's really nice to know what to expect. And again, most patients don't really feel like it's a big deal, and it's not painful during that time. You just are having to sort of suffer through these stages. So here's an example of someone's décolleté and neck. So we've done the treatment, and she's reddish bronze, she's peeling, and then baby fresh skin afterwards. Look at that difference. There is a lighting difference, but even with the lighting difference, you can see that her neck skin is tighter and her chest is so much better in terms of the pigmentation, brown spots, freckling, etc. So what about the safety of the Fraxel? Well, Fraxel was FDA approved in 2003. So we have over 20 years of FDA approved experience with this laser. And I really feel that translates into really knowing the settings that are going to be safe and the settings that will be the most effective per treatment. I think that's a benefit of using a device like this versus one of the newer competitors. Since it is the gold standard, it's very expensive as a medical practice for us to purchase. The consumables are extremely expensive, but you kind of can get what you pay for because in exchange, we have these really wow results from very few treatments. There are so many different ways to use the Fraxel. There are over 17 patents filed with the Fraxel. It's been around so long, there's been over 1 million treatments. That's amazing for a laser. And it's clinically proven, over 50 published clinical studies. And even that seems low to me. There are just there's so much literature about this laser. Here's a close-up of a treatment I did for cosmetic reasons. So you can see some pigmentation. You can see some fine lines if you look just to the right of her mouth on the before. And you can see in the after that the texture looks a lot better and the pigmentation looks a lot better. And the overall texture of her skin just looks more radiant and more youthful. Here's a patient. I used a multimodality approach. I combined liquid nitrogen and the Fraxel. So the larger 2 brown spots on her cheek are hereditary spots, and they will usually require a little bit extra treatment in addition to laser. So at the same time as the laser, I treated with liquid nitrogen. And then look at her texture change. Look at the smile lines before and after. Look at the glow of her skin before and after. And even if you can kind of see the area underneath her eye, it looks tighter in that area. So she was thrilled with her results. Here's a picture after one treatment of some pigmentation. So we've got a little bit of melasma and a little bit of sun damage, and you can see what a beautiful result this is. Here's a patient, again, the lighting is not super great here, but you can see only with a Fraxel treatment, in one treatment, she is getting some tightening. You can see her forehead is tighter. Her eyes look more awake. It's easier to see if we don't have them covered, but her eyes really, really opened up. You can see on her cheeks, the pigmentation is better. The skin looks more youthful. Look at her lower face. There's no filler, no Botox. She looks tighter in that area without having to do any filler or Botox. And of course, when we do combine the treatment with those things, we get an even better result. Here's an example of how the Fraxel can really work with texture, really works with a crepey texture. This is after one treatment, and the patient was really, really pleased. This patient was going to get a facelift, and she did the Fraxel before the facelift, so she would get a better result with her surgery, and which she did, and she was very happy. But in fact, I think, if I'm remembering correctly, she actually ended up postponing the facelift a little bit because she was so happy with those results. So again, this is why you choose the Fraxel. Fraxel is very, the concept of Fraxel is very low maintenance. The healing is not low maintenance, but the concept is low maintenance. I recommend once a year for preventative treatment. So preventing aging, preventing precancers, preventing skin cancers. And it's a little bit different if we're treating scarring, but usually a once a year treatment is perfect. Your results are going to be long lasting. This is producing so much collagen that your results translate into a decade or more of results. But since we age at the same time, I love it when my patients do Fraxel once a year because you continue to get better and better over time. Instead of aging, you're actually aging backwards and being preventative. So thank you so much for being here and for listening in on this webinar. As a thank you, we're going to raffle off 30 units of Botox with one of our new physicians, cosmetic physicians, Dr. Harb. She is a full-time dermatologist at PCH, but she works with us because she loves cosmetics and has had extensive cosmetic training. So she works with us after hours on Thursday evenings and some Saturdays. So we are going to do a raffle for all of the attendees. And what everyone's been waiting for, here are your promos. So we're going to offer a Fraxel of the face promo, face and chest, and face, neck, and chest. And so promo for the face, you're going to save $400. Excuse me. So the treatment of the face is $1,100. If you do the face and chest, the treatment will be $1,750. And by the way, we can totally customize this treatment for you. So if you really want to work on getting the wrinkles around the mouth, but on the chest, you want to treat more pigmentation, we can customize that treatment for you with the Fraxel. So we can treat all of those things with the Fraxel, and I use different wavelengths and different settings for that. And then we can do what's called the Ultimate Fall Rejuvenation, face, neck, and chest. This is the one I really recommend. You're going to get the most savings on this one. And we didn't really touch on it very much, but the neck skin can be very difficult to improve once we have a saggy neck. It's kind of bad news. The skin is very thin and it bears the brunt of gravity from the face and the neck itself. So anything we can do to tighten the skin at an early stage is super, super useful. The sooner you get started on the neck, the better. Sometimes patients will do treat their face once a year, but they will treat their neck twice a year. And that's a really proactive way to go about it. But I always recommend, if possible, adding your neck into the equation. And these promos can be done with myself, Dr. Yonan, Maya, and our esthetician, Nadia. So we have lots of availability for you. Here is the bad news. We're only going to honor this promotion until Monday. So you need to pre-purchase this promo either today or Monday, or email us over the weekend, text or email. Let us know which package you want. Face and chest, face, neck, and chest. And then we can get you scheduled. Excuse me a minute. So the next steps will be calling our cosmetic line. This is a direct cosmetic line, so you can call or text it. We have someone here who's manning the phone for the afternoon. And then please feel free to leave a message. Like I said, text. You can email us at cosmetics@cleardermatology.net. And if you email us over the weekend or call, we'll call you back. And then we'd love to answer your questions too. So even if you aren't sure if you want to purchase, but just have questions or want to come in for a consultation, we absolutely welcome that. We are going to change rooms. We're going to go into the Fraxel room for the Fraxel demonstration. I will actually be treating a neck today, so you can kind of see how quickly that can be achieved. And we can send some before and afters and some recovery photos too. While we are moving rooms, please think about any questions you have as a participant having witnessed this presentation, and I would love to answer them as I'm lasering my model's neck. So give us one moment, we'll set up and think of your questions. Hi, everyone. All right. Thank you for sticking with us. And this is Jenna, our beautiful model. So She is treating her neck today. We have treated her face several times, treated her décolleté. She's got great skin, but we are always trying to improve. So we're going to be treating her neck. I'm going to just, thank you. I'm going to just mark out where I'm going to go here. This little space right here is such an area for skin cancer because the sun rays kind of just collect in that area. So I always make sure I get that little scoop. And then you can see, even though her skin is so good, she grew up here in Arizona, you can see that little bit of texture change. So this Fraxel is really going to help this texture change. And even here you see some of this. This drives me nuts on myself. I actually need a Fraxel right now. I've been waiting for October to come so I can get this Fraxel done. So I'm just marking off some little areas of demarcation where I'm going to start and stop. And then if you could turn towards me, great. And a lot of times people do treat the chest and face and the neck all at the same time. And it's just a really easy way to treat the whole area, get it over with. And the results are really great. Okay, so you can go back to neutral. So there's that. Now I'll show you guys these settings. So we have two lasers in one system here. And so for her, she hasn't had any skin cancer. She hasn't had any pre-cancer. So I'm going to use this wavelength called the 1550 nanometer wavelength. It actually gives you less downtime. It's probably just like 3 days of redness. And it goes pretty deep into the skin. And that's going to result in a lot of, it's going to result in a lot of tightening. And so then this is our energy. And this is what controls the depth. So since we're off the face, we've got to be gentle with this neck skin. I'm going to go to that energy level. The treatment level is the percentage coverage. So this is the density or how spaced the little pixelations are. And then the number of passes is always 8. And then I'm always looking at the number of kilojoules that I've used because I have been doing this for so long. I know what it's supposed to be approximately. And so it's just like a way that I check myself that I'm doing the correct number of passes. And I'm just going to mark the number of passes here for myself to make sure that I'm doing the correct number because I'm going to also answer your questions and laser all at the same time. Okay, so let's get started. And do we have any questions coming in? Yay.
How is Fraxel different from Halo?
That is a great question. So Halo is a newer device. It came out on the market after Fraxel. And when I purchased this Fraxel, because this is a newer version of the sort of old school Fraxel, I did a deep dive, due diligence into what lasers were out there that were similar. And I really believe that this device is giving me more options than the Halo, but basically same concept. It's a pixelated or fractionated treatment, different manufacturer. I just happen to like this one better, and I think I can get better results, but Halo is still, you know, an acceptable treatment. Okay, I'm going to turn this on. All right, ready, Jenna? Okay, so we'll start here. And you hear that dimmer, that's the air cooler blowing, and that's going to cool her skin to make her more comfortable. And it's going to keep her safe too. Here we go. Let's see. 1 second. And here we go now. Okay, so how's that, Jenna? Awesome. Okay, I'm ready for another question.
For acne scars, what's the difference between V-beam and Fraxel?
Oh my gosh, you guys ask the best questions. Okay, so for V-beam, I like that for patients who still have acne, who have those red inflammatory spots. And I like that for patients who have red spots. So if you have redness that's left over from the acne or redness from the scarring itself, the V-beam is going to be our choice for that. The V-beam has less downtime than Fraxel. It's usually less expensive than Fraxel, and it's great for redness. When you do it multiple times, it also helps with collagen, but for the depressed acne scars, that would not be my first choice. My first choice would be the Fraxel laser.
Next question. Would you do a Fraxel treatment several weeks before filler and neurotoxin, or does the timing not matter?
I would separate them by 2 weeks. Specifically for the neurotoxin, we don't want to do the neurotoxin on the same day when you're going to have any swelling. So if there's something that creates swelling, we don't want to do the neurotoxin because that could cause spreading of the neurotoxin, and we don't want that. So I do filler and Fraxel same day. We can absolutely do that together. But with the neurotoxin, I usually say, let's do it 2 weeks before the Fraxel, because studies show if you have neurotoxin in place, when you're healing from the Fraxel, you actually heal with less wrinkles.
So the Fraxel keeps fine lines and wrinkles around eyes and lips, and also the treated pores around nose.
Fraxel is one of my favorite treatments for pores. We really don't have an ideal pore treatment. There's nothing that's like super, super useful for pores, but Fraxel does a pretty good job. It will reduce pores, in my opinion, by about 25%, which is, it sounds like a big percent, but it's pretty small because the pore is so small to begin with. But my patients do notice, and they are happy with the pore size after Fraxel. So it's really useful for that. And of course, our pores are biggest around our nose. You lower it a little bit. Now turn towards me. Regarding fine lines around the mouth, yes, this is in fact this 1550 nanometer wavelength. What I'm doing now for Jenna is my favorite wavelength for these lines around the mouth. It really, really helps with deeper lines, textures, wrinkles. It does not, it's not as effective for the brown spots, but around the mouth, usually we want the improvement for the wrinkles anyway. Now, a lot of times, in the most ideal world, I would choose someone to do filler and the Fraxel, because the two together are dynamite. They're going to work so well, and the filler will give you a little bit of instant gratification. Fraxel, the collagen, takes some time to grow. It's like planting a little collagen garden when we do the treatment. So it takes a little bit more time to see the results.
Question. For hair coloring, how long should a patient wait after the treatment and before the treatment?
The hair coloring, I don't really mind. I think for your own comfort, you'd want to wait like a week afterwards. In terms of before, it doesn't matter to me. You can do the hair the day before if you wanted to. But afterwards, you're probably not going to be super comfortable sitting in a salon for several hours. And plus, I wouldn't want you in that bright light for several hours. So I would say just maybe wait a week afterwards or do it right before. Great question.
Question. How effective is Fraxel on skin over 80?
I love that question. I love that you're over 80 and thinking about it. It works wonderfully. In fact, that last photo I showed of the woman who'd postponed her facelift, she was not over 80, but she, was in her 70s, I believe. And I Fraxel patients of all ages, including patients in their 80s. So I would say it works well. It's not going to look like you've had a facelift, but there's lots of benefits from doing something so minimally invasive and safe.
What is the difference between soft wave and Fraxel?
So you could see in those photos that Fraxel will help brown spots and the peeling is like an exfoliator, whereas the soft wave goes underneath the first layer of the skin. So it does not work on the brown spots, but we also do not have to worry about if you've had sun recently and there's no downtime. So both will stimulate collagen. Both will stimulate something called elastin. Both give you amazing texture improvements. Fraxel works better for brown spots and deeper lines around the mouth. Soft wave works better for lifting a little bit, lifting the eyebrows, lifting the cheeks a little bit. And both work so well for collagen and elastin production. You can see that that was easy. Probably easier for me than it was for Jenna, but how did you do? It was great.
Yeah.
And you can see afterwards with this 1550 nanometer, it's not very red. She looks like normal basically. And she did great. And what other questions do we have? We can take the next off.
Next one, are there any supplements or vitamins you should or should not avoid before or after the treatment?
I love that. If you are taking something like aspirin or take a lot of ibuprofen and you have the Fraxel, you may have some very mild bruising, like teeny tiny little bruises. You can take this. And it's not a problem. It just kind of adds to the downtime. But so that would be a supplement to avoid anything that thins the blood. If you are worried about the puffiness, you can take arnica and bromelain. Arnica is, many of you know, arnica is homeopathic, and bromelain is an enzyme. It's a supplement, and it's an enzyme found in fresh pineapple, and it's both of those things are anti-inflammatory. They're thought to work better together, and so that would help to reduce inflammation and swelling after the Fraxel.
And then last question, can you use Fraxel on your hands?
Oh my gosh, you absolutely can. And we should have actually put that in the presentation. So thank you so much for bringing that up. We have had amazing results on the hands. The hands are wonderful. In fact, it's so funny. I had my hands treated and I sent my friends a picture of my two friends, a picture of my hands. And then before I knew it, like literally the next week, they were in having the Fraxel on their hands. It's really great for the crepiness. It's great for discoloration. I can combine it with liquid nitrogen to get bigger brown spots. It'll get smaller brown spots, and then it'll help the texture. 100% recommend. Thanks, guys. Thank you so much for participating. Please let us know if you have any other questions. We're happy to help and hope to see you soon.